Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us here on Health Professional Radio. In this segment, we're going to be speaking with Beverly Taylor. She's joining us here from CSL Seqirus to talk about avian flu and global surveillance of the avian flu and why it's so important. Welcome to Health Professional Radio, Beverly Taylor.
Thank you very much. It's a pleasure to be here.
Tell our listeners a bit about yourself, who Beverly Taylor is briefly, and your current role at CSL Seqirus.
Thank you, Neil. Well, I've been at CSL Seqirus for just over 23 years, always working on vaccines and with a focus on influenza. I have experience of running vaccine manufacturing, quality control, technology development, so very technical background. And for over 10 years, I've also worked with external industry associations as well as the World Health Organization, other non-governmental organizations and governments. And in my current role as head of Global Influenza Scientific Policy, I really provide the interface between influenza science and policy issues working through these associations and organizations.
Can you give us a brief overview of the current avian flu outbreaks that we've been hearing about across the globe?
Yes, I certainly can. From late last year and earlier this year, we've seen a really high number of outbreaks of avian influenza activity or bird flu amongst wild and farm birds as well as commercial poultry. This is an H5N1 virus, and it's been reported from various parts of Africa, Asia, and particularly in Europe and North America. This has continued in recent months, with the majority of U.S. states reporting highly pathogenic avian influenza occurrences in wild birds and poultry. Just to give you a picture of how widespread this is, by the end of September in the U.S., there were close to 500 confirmed outbreaks in flocks, and that covers both commercial and backyard flocks across 40 states, with about 47 million birds being culled. Cases in wild birds have also been reported right across the U.S., and these outbreaks in both poultry and wild birds continue to be reported, and more recently there have now been some reports of infections in wild mammals. It's not unusual for us to see an increase in avian influenza during the bird migratory seasons, and if you look at the flight paths of the migratory birds, you can see how the avian influenza is introduced into countries. However, these high levels have not been seen in recent years and are unusual. And another observation is that the bird flu did not go away during the summer months. And this means that the bird flu may now be endemic in native species of wild birds, and we may see a higher level of cases in the future. And this, for me, really reaffirms how critical it is to monitor the number of cases and the geographic spread of the viruses and be prepared for the ever-present threat of an influenza pandemic. I just want to say that CSL Seqirus is really on the front line of the fight against influenza, both seasonal and pandemic. And as part of this, we constantly monitor the avian influenza outbreaks and the viruses that are causing them. And we also have collaborations with a number of academic institutions, really focusing on research projects and knowledge generation about the threat of seasonal influenza and also the development of innovative approaches to pandemic preparedness and response.
How difficult is it to track these outbreaks worldwide? What are some of the strengths and weaknesses? Where are the gaps? Are there some regions that are seriously more affected than others? Are there some regions that get surveillance because of economic abilities or the lack thereof?
Yeah, so, it really is. We do have a very strong surveillance system for human cases for influenza. And this is absolutely critical. We're really fortunate that the World Health Organization has a really well-established system, which has just celebrated its 70th anniversary. And it's made up, there's 158 labs in 127 countries routinely collecting virus specimens in their countries and performing the analysis to track these circulating viruses. And they have an obligation to report an atypical influenza virus to the World Health Organization as soon as they are detected. And it is worth noting that this system was also used for the response to the COVID-19 pandemic as well, because it was already in place. So it's a really, really valuable system. There are strengths and weaknesses. Obviously some regions are better covered by this surveillance network than others. And it's also critical. I mean, that only really covers the human cases. WHO also look at activity at the animal-human interface. So it's not just the seasonal viruses that are picking up, it's also viruses that are infecting humans from animals. And it's really critical that outbreaks of disease in animal and birds are also monitored. And this is carried out by the World Organization for Animal Health, or WOA, as well as other surveillance networks, for example, USDA. They provide critical data and ongoing monitoring, which really helps inform what response is required and how an emerging virus may be spreading. That's really critical for us. We constantly monitor that information.
Explain to us the important role of global surveillance as it pertains to pandemic preparedness.
Yeah, okay. So it's really critical. And I just want to say that public health organizations such as WHO or the US CDC have developed risk assessment tools to look at some of the avian influenzas and see what risk they carry for humans. And the current public risk is estimated to be low. However, it's critical that we keep track of this because the mortality rate of some of the H5 viruses in humans is usually very high. It's about 50%. And it's really important to be prepared for a pandemic. So CSL Seqirus have pandemic contracts with more than 30 governments around the world to supply vaccine in the event of a pandemic. This includes BARDA in the US, and these long-standing public-private partnerships are really important to support pandemic preparedness and rapid response efforts. So, for example, we would get vaccine viruses, which represent some of the circulating viruses, in-house so that we're ready to respond very quickly in the event of a pandemic.
It's my understanding that there was a presentation at the most recent Options Conference. Could you share the basis of that presentation and give us some key takeaways? Yeah,
so just for people's information, the Options Conference is a big influenza conference, which is held every 3 years, and it was last held in September this year. And we presented on the importance of epizootic, that's the disease in animals, and zoonotic influenza surveillance. So zoonotic infections are animal infections in humans. We presented the importance of the surveillance as to enable a rapid pandemic response. Really, this is our early warning system, and we really need to be monitoring outbreaks. We know that influenza causes pandemics. It's caused 4 in the last just over 100 years, and the importance of remaining vigilant to pick these outbreaks up.
Well, I appreciate your time this morning. Thank you so much for joining us here on Health Professional Radio. Give our listeners a website where we can learn more about CSL Seqirus and the developments there.
Okay, you can get more information at www.seqirus.com.
Great. Beverly, thank you so much once again, and I'm looking forward to our next conversation.
Thank you very much. It's been a pleasure.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Beverly Taylor. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.